Finale, everybody, our finale of the Southeast Nursing Midwifery Green Week and our webinars. So, and I have to say, it's been an absolutely brilliant week. I feel very fortunate, and to have chaired the sessions on Monday. It was Wednesday, and obviously today. And huge thanks to Kay Wilson for chairing the sessions on Tuesday. And Thursday. The quality of the presentations have been phenomenal, absolutely phenomenal. And I've learned so much, actually. I have to say, I've learned a great deal. So thank you. But we'll do more thanks later on. Obviously, throughout this week, we've had our themed days where we've had our webinar. So just to give a recap, day one was all around population health and our role as nurses and midwifery and midwives as to what we can do around the green agenda. Then on day two, we talked about the nursing care and midwifery care pathways around the sustainability agenda. Then on Wednesday, we had some brilliant presentations on the children and young people. And obviously a lot that's happening in that space around the sustainability agenda. And then yesterday was at the innovations in healthcare. And today we finish on our clinical leadership themed focus session. So we've got two speakers today who are presenting to us. Firstly is Miranda Rogers, who's an ST1 paediatric doctor at Frimley, who's going to be talking to us about the feasibility and impact. Oh, a bit of echo there. Sorry. We'll go on mute. Yeah. Okay, hopefully everyone can hear me now. Yes, Miranda, who's going to talk to us about the feasibility and impact of a lift steering group on the community and the impact on CO2 emissions. And then we've got the great Lucy Brown, who many of you will know was from the Florence Nightingale Foundation, now has started a new job as a European clinical delivery lead. Great to see you, Lucy. And you're working for the Centre for Sustainable Healthcare, and you're going to be talking about integrating sustainable practices in healthcare. So a huge thanks to our presenters. It's lovely for you to be here today. Really looking forward to your presentations. And obviously, once you've finished your presentations, then we'll be going into the finale of the finale, which is the award ceremony, which will be a nice thing to finish off as well. So we'll talk a little bit more about that once we've heard our presentations. So without further ado, we'll now hand over to Miranda. Are you there, Miranda? And the floor is yours.
Oh, fantastic. Thank you so much. Yeah, I'm here. As mentioned before, my name's Miranda and I'm one of the ST1 paediatric trainees in Wexham Park Hospital. So thank you so much for having me today, because I'm obviously not a nurse or a midwife, but I hope that what I can talk about that we've done is applicable to you guys, and I can show you how easy and how meaningful having a lift sharing group can be on commuting and on CO2 emissions. Fab, so could I have the next slide, please? Fab. So I'm sure that we're all aware that climate change has huge implications for the health and well-being of everyone, and that includes children. So in 2020, the Royal College of Paediatrics and Child Health developed an action plan to tackle climate change. And this included the ambition to support members to advocate for improved sustainability in their clinical work and workplaces. Next slide, please. So I won't be teaching anyone new by saying that cars are key emitters of CO2. The United States Environmental Protection Agency estimates that a typical passenger vehicle emits 4.6 metric tons of CO2 per year. Next slide, please. Despite our knowledge of this, the rotational nature of paediatric training programs means that commuting by car is almost inevitable. This is the case in the Thames Valley Deanery, so the deanery that I work in and that Wexham Park Hospital is based in, where the shortest distance between different trusts is 22 miles and the longest is 75 miles, as demonstrated on this map here. So we tend to change at least every year, change hospitals, and often people don't want to change where they live every year. So that means that commuting is an inevitable part of our lives. So next slide, please. In an attempt to try and reduce the number of individual journeys taken, a lift sharing group on WhatsApp was established for doctors working in paediatrics in Wexham Park Hospital, but living and commuting from Oxford. So this was started back in September 2022, and it's still running now. Next slide, please. The journey from Oxford to Wexham Park Hospital is 38 miles each way, as shown on my little infographic here. The WhatsApp group has had up to 15 active members who have owned a mixture of petrol and electric cars. Next slide. So our aim in this project was to evaluate the potential benefits of our lift sharing group, firstly on the number of journeys taken between Oxford and Wexham Park Hospital, and subsequently, as a result of this, on the CO2 emissions from the vehicle use reduction. Next slide. So in order to do this, we first retrospectively reviewed rotas to determine the total number of lifts that would have been taken between Oxford and Wexham without the lift sharing group. So we conducted this analysis over a 20-week period between the 1st of June and the 20th of October 2023. Next slide. We then reviewed the WhatsApp lift share group messages to identify the number of lifts that actually were shared over this same 20-week period. We then assessed whether the vehicle used for the lift share was petrol or whether it was electric, because that would impact on our CO2 emissions. Next slide, please. So from this, we then estimated the number of tons of CO2 saved using an online MyClimate car emissions calculator. And then finally, we extrapolated this 20 weeks of data to 1 year to try and look at the potential annual benefits. Next slide, please. So in terms of our results, we showed that lift sharing was achieved on 51 out of 144 days that were assessed, which is roughly 35% of the time. If we excluded weekends and bank holidays, because these are days where lift sharing was much less likely to happen because fewer staff members were working, lift sharing was achieved 45% of the time. Next slide, please. When we look at the number of single journeys taken, the lift sharing group results in 186 fewer lifts taken, which is equivalent to 18% fewer single journeys. Next slide, please. This 18% reduction in lifts results in an 18% reduction in CO2 emissions, so a reduction in a total of 2.8 fewer metric tons of CO2 emitted, which is still accounting for petrol and electric car use. Next slide, please. We then extrapolated these results to 1 year and estimated that the lift share group would annually result in 437 fewer single journeys taken and a saving of 7.4 metric tons of CO2. Next slide, please. To try and put this number into context, because I don't know about you, but 7.4 tons of CO2 doesn't really mean that much to me. This is equivalent to a number of different things. The one that was most meaningful to me was it's equivalent to the carbon sequestered by 122 tree saplings grown for 10 years. Next slide, please. So in conclusion, our study demonstrates that firstly, that despite on-call rotas and actually a relatively small number of trainees involved, frequent lift sharing is possible and it's relatively simple to do. We just did this using a WhatsApp group and just messaging each other. Next slide, please. Secondly, I hope that I've convinced you that lift sharing has a substantial effect on CO2 emissions, especially when we consider this over the course of a year. Our study was only looking at a 20-week period just because that was when we had the data that was accessible. But actually, when we extrapolated it, it actually had a pretty substantial impact on the total number of lifts and the CO2 saved. Next slide, please. So, as indicated on this map here, the Thames Valley Deanery is one of the much smaller deaneries. And despite this, I hope that this experience can encourage other doctors in other regions to do similar things, but also can encourage you guys as nurses and midwives who also are likely to be commuting in by car and are likely to live outside of your hospital to coordinate with friends, with other colleagues to see if you can do a similar thing to share lifts and reduce the amount of CO2. And also it's really fun sharing a lift. It's nice to have a chat with people. So next slide, please. So I'd like to thank my co-authors, Rafe, Cleo and Claire, for all their help with envisaging and conducting this study. And I'd also like to thank all of the other members of the LiftShare group, past and present, who have obviously made the results of this possible. And I'd like to thank the Wexham Park Hospital Paediatrics team for their ongoing support with this. Next slide. Finally, I'd like to thank all of you for all of your time and interest in this study and for giving me a slot to present today. And very happy to take any questions or thoughts or comments that you might all have. Thank you.
Brilliant. Thank you. Thank you, Miranda. Wow. I mean, honestly, I mean, I don't know who else has done this, and there may be that other people have done this, but I think what's really highlighted is clearly the impact that this can have. I think that's illustrated it so well. But what opportunity? There's such a huge opportunity, isn't there, around this for the NHS? And we're such a huge workforce, and you've shown actually, you know, what you can in quite I'd say small scale, just because of the NHS workforce being so huge, but actually the results are quite significant. So there's huge opportunity around all of this. I think absolutely, you've illustrated it so well. It's fantastic. Anyway, I'll open it up if anybody's got any questions. Kay, you did put your hand up. Were you going for your emoji instead of your hand?
I was trying to clap. You know what I'm like. I'm hopeless at those buttons.
Oh, well, thank you.
No, I was. Emma, did you want to come in?
Thank you so much. I absolutely loved this presentation and the work that you've done here. I think it's really vital, and I love to see this kind of work working, if that makes sense. So I'm a nurse and currently seconded into NHS England, but I'd normally be at the JR in the endoscopy department. And one of the questions we often get, because we float this idea to, like, we've been talking about this to colleagues and seeing what we could do, and two of the big things we hear is, one, when shifts and late, coordinating with each other so we're not leaving a colleague stranded, things like that, and then if caring responsibilities come up during the day. And so I'm really intrigued if those conversations were happening, you know, if the WhatsApp group was helping to sort of manage that kind of situation and you made it work. I'd love to know what kind of things you did to make it work, basically. Thank you very much.
Yeah, no, absolutely. And they're really, really good points, and things that I was a bit skeptical of when I first joined the WhatsApp group, because I was a bit like, oh, you know, people often leave late, and am I going to end up hanging around for ages waiting for a lift or waiting for other people to come out? But actually, I think at least I am, and I think other people are often very honest if they're like, oh, actually, I really need to go and pick up my children from football by this time, so I can give you a lift if you are kind of in clinic and you think you're going to finish in time, but you know, if you're on call and you think there's a potential they might leave late, it's probably better for you to get a lift with this other person instead. And we've actually found that there's been enough of us that usually we can make that work. I think Claire is around, and she's been in the group for longer than I have. I only joined in September. So I don't know whether we've ever had any problems with anyone having a caring responsibility and needing to leave work halfway through when they've been due to give someone a lift. I don't know whether she's still here or not. She might know.
Yeah. Hi, Miranda. A great presentation, by the way. Fantastic. Like Miranda said, usually the person who has to leave to collect the kids from football is actually me on a Mondays. And usually fairly, you know, I put that on the WhatsApp group so people know that I'll have to leave, and that's usually fine. We haven't had anybody leave anyone else behind. Actually, I'm going to rephrase that. We haven't had anyone leave for childcare purposes. I have to admit, I have accidentally left and forgotten my person I'm giving a lift to, and had to go back for them. But that won't be happening again. So those kind of things, you know, genuine human errors have happened. But generally, it's been fine. Of course, sometimes people hand over a little bit. Sometimes someone is waiting sort of 15 minutes, that kind of thing. But we haven't had anyone waiting huge amounts of times. And sometimes I actually think it's been quite good at making us be finished on time and be a bit prompter. Because I do think sometimes towards the end of the day, there is a tendency to just kind of get one more thing done. But actually, in terms of, for me, making me say, actually, I've got people I'm giving a lift to, I'm going to finish this now. That's been quite a positive aspect.
Yeah, I definitely echo that. It's definitely made me do my handovers more efficiently and made me say, actually, this doesn't need to happen today. I know I'd quite like to get it done, but it's not going to delay anyone's discharge. It's not going to affect anyone's care. I can come back. I can do this tomorrow. And having that kind of attitude is quite a good thing to develop. And as long as, you know, you're being safe and sensible, then that is okay. So it has benefited me. And sometimes I have to wait 15 minutes, but then I just do a bit of admin that I need to do and get it done. So it all works out quite well.
Brilliant. You sort of touched upon the health and well-being bit there, actually. Interesting, you know. So yeah, so the sort of work ethic, isn't it, and all of that. So it really helps. So, brilliant. Okay, some great comments in the chat as well. So I'll let you guys have a look. But Miranda, thank you so much for that presentation. And that leads on. That leads us nicely into Lucy Brown. So Lucy, I'll let you introduce yourself. But over to you. Thank you so much.
Oh, thank you so much for inviting me. It's so nice to see so many familiar faces. So I'm Lucy Brown, as Andrea said, and thank you for the invite, Lucy and Kate. It's a pleasure to be here this afternoon. I'm a very proud nurse, and as Andrea rightly said, I've just started a new role at the Centre for Sustainable Healthcare, and it really is following my passion, and that's why I took the leap of faith. A very different role, but something I'm absolutely enjoying. Week three into post, but I've got a bit of a presentation to share with you today, and I'm going to take you on a bit of a journey. So I'm probably going to shock some of you, and I think we've got enthusiasts on this call anyway, so I think you're already converted on the importance of sustainable healthcare. But the idea is that I'm going to raise awareness amongst all of you, give you some evidence to take back to your teams to bring everybody on board, share some hope for the future, and actually a bit of a call to action for all us nurses and midwives, because believe it or not, I think we collectively, working collaboratively, could change the trajectory of this planet. So I've got a few slides, there's quite a few, so we're going to whiz through. But lots of evidence for you to share, lots of further reading, so I won't kind of labour too long on the slides, but click on the links, loads of evidence to back up what we're going to say. But it's really great to be part of the Greener Week, and I feel very privileged to be with you all this afternoon. So I'm just going to share my screen. Okay. Should be coming up, just loading. Lovely, can you all see that? Brilliant. Thanks,
yeah,
Kate.
we can.
I love it. Lovely fascinator. I love it. I feel a bit underdressed like you, Andrew, with that. Didn't get the dress code, but I did wear green. I did wear green for you all. So, as I said, this will be a call to action. So, and actually, interestingly, I am set up a consultancy business as well, a co-founder, which will be looking at leading sustainable change as well, but more about that in the future. But just want to share this, something that we're really, really passionate about. So I'm going to start off with something quite obvious. What is sustainable healthcare? So this is a really lovely brief from the Centre of Sustainable Healthcare where I work now. It's the ability to provide healthcare to meet the needs of the present generation without compromising the health of future generations, which I think is a really lovely way to describe it. It's understanding that our health and the environment are intrinsically linked and act in a way that supports both people and planetary health. We're not apart from nature. As the Oxford English Dictionary tells us, we're actually part of nature. And together we can work together to change the trajectory. What's next? So what does that mean for us in clinical practice? I think if I had a pound for every time I heard about sustainable healthcare, we talk about recycling, which is important. I'm not taking away from that. It is very important to think about reducing waste and how we segregate waste. But actually, there's so much more we can do. The Principles for Sustainable Clinical Practice, which was written by a pioneer, Frances Mortimer. The links there to her article about the sustainable physician, but this applies to all of us in nursing and midwifery as well. So it's about prevention. And this is probably the way that we can really make a difference, is just like sharing with the patients that we look after. You know, we're in a unique position where we're highly trusted in our profession, and we can actually educate the population on healthy choices, preventing them from even accessing acute services, which are obviously very carbon burdensome and obviously very polluting for our environment. So what can we do in actually addressing inequalities in healthcare? There's loads more you can read about that, but actually we can have a massive influence on the health outcomes of our populations. And that's why we became nurses and midwives, wasn't it, to really make a difference. Next is out along the same vein is patient self-care. So actually empowering patients to take a greater role in, so looking at ourselves, exercise, eating well, all the obvious things, but really empowering them to take the lead in their own health and their own healthcare. So preventing those chronic disease processes that obviously will leave them with long-term health processes. Next, lean service delivery. This is something I get a little bit excited about. As nurses on the front line and midwives, we see day in, day out, don't we? You always question, you say, why are we doing it like this? This doesn't make sense. This isn't very efficient. Why are we throwing this away? Why aren't we using this? You know, how many times have you opened up a dressing pack or something along those lines, wherever you've been, and thinking, God, why am I throwing all this away? I'm not even using it. We need to start questioning and asking why, and getting people to listen and being bold and asking why. That's something I'm going to hopefully hope you take away today. And then finally, the fourth part of Principles of Sustainable Clinical Practice is about low carbon alternatives. So swapping out, thinking about different technologies, similar to the last presentation, thinking about transport. Patient transport's a brilliant thing. Oh, thanks, Susan. Lovely to see you as well. And all of those amazing, I'll take questions at the end if that's okay. But pricing treatments as well. And there's so much we can do in this space. So keep that all in your mind, and lots of reading around that. So, and I know I'm probably preaching to the converted, but this is for you to take back to your teams. I'm just going to go to the next slide. Why do we need to focus on sustainable healthcare? Now, this might make you feel a bit sad, but don't worry. I'm going to give you a bit of hope at the end. But it really is, this helped me to wake up and realise that we really do need to do something about this. This isn't something we want to do in a year's time, 5 years' time, 10 years' time. We need to act now. And this is just going to take on a bit of a whistle-stop tour to what's happening to our planet. Can't stick our fingers in the ears. I was speaking to some colleagues yesterday, said so many people are putting their head in the sand and pretending this isn't happening. We need to raise awareness across our populations, and it starts with us. So this probably won't seem surprising, but the carbon footprint of global healthcare is 2 gigatons of carbon emissions. A bit horrible, isn't it? Outdoor air pollution kills 4.2 million. That's actually 4.5 now. People worldwide. I've got a bit more data on that. 2% of the global plastic production is medical plastic. You probably won't be too surprised at the amount of syringes that we throw away. It's pretty disgusting, isn't it? And this is increasing by 6.3% each year. Deforestation of our wonderful native rainforests and forests are made way for rubber plantations, for instance, perhaps palm oil, but those rubber plantations are used for surgical gloves and other medical equipment. There's this huge scarcity of resources, for minerals that we use in medical equipment as well. And this one I found particularly shocking, if I'm honest, that antibiotics have been found in 65% of our rivers. Well, boy, that's in our drinking water. So actually, we're looking at our immunity is going to be affected as a result of that. More to come. So obviously, why? Another reason why, it's part of the UN Sustainable Development Goals, which have been around for a number of years now. And there's the wonderful Charlotte Mercado. I think she's flying the green flag for us all, is really paving the way and really being a pioneer in greener healthcare. It's nice to see some of her team here as well. But high quality care is low carbon care. So it doesn't go, it's not separate. It's actually aligned to patient safety as well. There's lots more evidence to back that up. And also Simon Stevens, the climate emergency is a health emergency. They're not separate. They're absolutely interlinked, as we said earlier. And more around that, obviously, you know all about the UN Sustainable Development Goals, I'm sure, so I won't labour too long on that point. So the next slide. Here's some evidence for you to take back to those disbelievers. We need to educate them, don't we, and raise awareness. This probably doesn't seem, this is from NASA. This is the temperature of the planet rising, fairly self-explanatory there. And some of those disbelievers and non-believers will say, oh, that's only one record keeping. So the next slide is for you to take back to them. And it shows you all the different metabolic going off into there, meta offices and climatic centres that are recording the temperature of the planet. And look at that, it's all on the same trajectory. We're heating up. We are heating up. And it's quite frightening to see, isn't it? So what does that mean? And I will be honest, I did cry when I first saw this. This is a picture, and you can follow the link, and it shows the trajectory of all the forest fires, all the wildfires across our planet. And that made me quite sad when I first saw this. Our world's on fire. And I know we naturally have forest fires across our planet. I know we naturally have those as part of forest ecology. But actually they have grown, and you can see that the way there's a timeline when you go onto the website of how it's got worse over the last couple of years. The world's on fire, the temperature of our planet is rising. So what does that mean? I'm getting goosebumpy saying this to you all because I get quite passionate. but this is for you to educate yourselves. What does this mean? There are 28 to 36,000 excess deaths per year due to air pollution alone in the UK. That's just the UK. Got some evidence to back up what I'm saying as well, so from Public Health England. But actually, if we manage to reduce the air pollution particles, look at the difference that would make. Almost 51,000 less cases of coronary heart disease, 16,500 less strokes. So actually, we can make a difference. What does that mean globally? There's 4.5, so I said earlier 4.2, it's actually gone up 4.5 million excess deaths due to air pollution each year. I had the fortune of going to Montreal last year to present at the ICN Congress on a project I'll share with you in a moment. And while we were there, the forest fires were blazing in the Canadian outback. And as a result, there was a warning we couldn't leave our hotels. So it's real, it's happening on our planet and experiencing it. So we just need to make sure we educate ourselves and know what's going on with the planet. This is another bit of data for you to share about the 4.5 million deaths around. It shows you the hotspots around the globe. We are making a reduction in the UK, which is brilliant, but there's much, much more we can do. So just some more data for you to read. So what does it mean about the temperature rising as well? So we're going to see more droughts in the world, and we're going to see heat risk as well. So what does excessive heat do to the population? So there's 345,000 additional deaths in the over 65. So they're really, really going to struggle those extremities of the lifespan. So the young and the old are really going to suffer as a result of the heated up temperature. And also, perhaps importantly so, but not quite as important, is 295 billion. That's a huge hours of lost work due to climate change and climatic differences. Here's some more data for you. Oh, just clicked on the wrong button there. Just to share for you to take back to your teams and read a bit more. There's links all there for you to read. But it really is a real concern about the rising temperature. And I had the fortune of meeting a chap in America who is studying this. And there's extensive studies looking at the impact on our populations. So there's a lot we need to do. And this was a study, I added this in, I don't mind Lucy and Kate, I only read this a couple of days ago. This is a new study that was only published a couple of weeks ago on the effect of micro and nanoplastics on the human body. Have a little read. I'm not going to go through all of that with you. I'll let you read it in your own time. But it was really quite concerning. And what concerned me the most is that nanoplastics can actually be transmitted via the placenta, via blood. So some nods in the audience. I was shocked as a children's nurse. I was like, oh my goodness, what are we doing to our future generations? We really, really need to tackle this. So have a read. There's some really interesting information, and share it far and wide. People really need to be educated on what's happening now, as I said. So lots that we need to do. I promise I won't make you more depressed. I'll try and lift you on a Friday afternoon for your awards ceremony. But just to really summarise, and this is a really nice, there's the link there as well for you to share some evidence about what's happening. So air pollution I've kind of touched on, and increasing allergens, extreme heat I've touched on as well, drought, which obviously with the extreme heat, water supplies, we've got antibiotics in our water supplies as well. Environmental degradation, people are going to be losing their homes, their jobs. So it's something we really need to think about. And conflict of the atrocities that are happening in Gaza that we're seeing, and the Ukraine and Sudan. There's unsettlement, there's unrest across our planet. People have no homes. We've got to bear that in mind. Wildfires I've touched on as well. Living conditions and social inequities, we really can play a factor in that. Changes in vector ecology, so we're going to see more wonderful vectors like the viruses, Lyme disease on the increase, as well as the polar caps melt for other reasons as well. But the polar caps melt, we're actually exposing more mosquitoes and parasites and those and the like. Food system, we're going to see higher food prices. We're already experiencing this, aren't we? All of us. A cost of living crisis is real, and we're experiencing that. But also a lot more malnutrition as well, because people won't be able to afford to eat, and there won't be so much food available. I think we should start growing our own veg too. So there you go. And severe weather, we're seeing that. I don't know about where you live in the world, but I've had floods where I live, quite substantial as well, and water quality impacts. All of this we're seeing now. This isn't last week. This isn't 5 years, 10 years. This is now. We need to act. So don't worry, I've brought you down. I'm going to take you on a journey, as I promised. I'm going to bring you back up now, because there's hope. There's hope, and it starts with all of us, the wonderful nurses and midwives, Because let's be honest, we join the profession because we care, don't we? We really, really care, and we want to make a difference, and we will. These are some of the incredible organisations that are doing incredible things. And there's many more, but I've just pulled out some of the best ones. Obviously, Centre for Sustainable Healthcare, it'd be amiss of me not to discuss what we're doing and more on what we're doing in that area. The wonderful Florence Nightingale Foundation have got brilliant green leadership programmes that I know that Emma and Rod are involved in too, and Imogen. The greener NHS, paving the way in a healthcare setting. I was really proud to be at an event a couple of weeks ago in Sweden, launching the project for my new role, and I was really proud to kind of talk about what the NHS was doing and paving the way. So that was great to be. The Alliance of Nurses for Healthy Environments, they're an American organisation that are really doing incredible things, and all of these people, which I must really labour the point, want to collaborate. It's not about competition, it's not about IP, it's about sharing what people are learning for the greater good. So it's just in our gift to actually just go and learn and share so that we can all benefit across our health systems. Bupa are doing amazing things. Nuffield Health are doing incredible things too. The Royal College of Nursing, we've got a new sustainability programme, and the Planetary Health Alliance. Now, I'm going to fangirl a little bit, please forgive me, but I met Teddy Potter. Please look her up if you get the chance. She is a wonderful nurse like all of us, and she is a trailblazer. And again, I met her in Montreal, and she had the most profound effect on me. I think it's probably made my decision to change roles as well, if I'm being honest, to pursue what I really care about, sustainability. But she said to me, she looked me in the eye, she said, "This is your soul's work. Nurses and midwives can change the trajectory of this planet if we all work together." And I believe her. And what I love equally is she's part of the partners that set up the Planetary Health Alliance. Who are based, oh, thanks, Emma. That's brilliant. Who set up the Planetary Health Alliance. It's based at Harvard University. And what I love is she's the chair, and this is all medical professionals, no offence to the doctors on the calls, but she's a nurse and she chairs this alliance. So I just thought, brilliant for us. We're paving the way forward. Make sure, and you can join. It's for free, and there's loads of resources on there as well. So get looking, educate yourselves, and share with all of your teams. I haven't finished yet because there's more wonderful organisations. Obviously, Florence Nightingale Foundation, I would be amiss not to mention the wonderful organisation I've just left, and I was a scholar there too. They're doing amazing things on the Greener Leadership Programme, the Empowering Sustainable Leaders for more senior leaders as well. So, get involved, signpost people to those programmes too. We've got the Carbon Trust, the Lancet are paving the way, Greener NHS, the King's Fund are doing brilliant things. Chris Naylor there is doing great things. The World Health Organization, they've got a webinar running at the same time as this, but it's been recorded. So have a read. They're talking about a toolkit for sustainability, and they've been doing a lot this week. So there's loads you can get involved in, absolutely loads. So make a difference. So I hope I'm lifting you back up because that was the purpose of my talk. There are 46 million healthcare workers in the world. And we're all pretty much joined healthcare, as I said earlier, because we care, don't we? We want to make a difference. Didn't go into it for the money, did we? We went in to make a difference because we want to change people's lives and impact on them every day. So of those 46 million, most of them are nurses, aren't they? There's about 28 million, depending on where you get your data from across. We can influence nurses, patients, all populations from cradle to grave, can't we? We impact and see people at the worst times of their lives and the best times of their lives. And we can influence as well. We're the most trusted profession. We've got some data on that in a minute as well for you to take away. So I guess my message to you is you don't have to be a climate science expert to make a difference in sustainability. You can make small incremental changes to practice to really impact on the greater. All of those incremental changes will build up. Imagine 28 million nurses having an impact of everyone around us, the difference that we could make. And it should be non-hierarchical. It's about all working together for the greater good. Collaboration, not competition, is my big phrase I come up with. It's about working together and sharing resources and making sure that everyone benefits, and ultimately our population and the planet as well. So here's some more data for you just to prove what I'm saying is right. So this wonderful Ipsos Mori survey, look at that, right at the top, nurses and midwives are the most trusted profession in the world. So that's pretty amazing. 94% people trust us. So actually we can have great influence. And this is where we can pave the way. We can influence everyone around us, the population, to make great change. And I really, really do, in my heart and soul, believe that we can do that. It takes away. I'm going to share a little bit of a plug for the programme at the Florence Nightingale Foundation that Nuffield did. But this I just wanted to share because it's a poster we presented at the ICN Congress. But it shows the change, and the purpose of me sharing this with you is 18 wonderful frontline nurses. Unfortunately, no midwives on this cohort, but frontline nurses with small incremental changes to practice. And I'm talking about small changes, like changing something in a pathway, or removing blue roll, I think one of the programs, or changing the way a theatre process is run. 18 nurses who are frontline nurses, and they only changed practice within their area. So not across the hospital site or across multiple sites, just their ward or their clinic that they worked within. And they put these changes in place through learning SUSQI, so Sustainable Quality Improvement Methodologies, bit of science behind it there, but also about empowering them to speak up and to believe in themselves and not take no for an answer. And through that, they embedded some brilliant changes. And those 18 projects, which are listed there, and I'll let you read in your own time, saved 6,281 tonnes of carbon, which is just phenomenal. It's nurses, 18 frontline nurses, which I think is just phenomenal. Imagine what 28 million of us could do. Be amazing, wouldn't it? So I'll leave that there. You can read that in your own time. There's more information. Obviously, I've changed the details because I'm not there anymore, but get in contact with FNF and the rest of the team. So I've also wanted to show, if you're really interested, this is a really brilliant framework that was authored by Telly Potter, who I spoke about earlier, and her team at the University of Minnesota and broader. And this is really, it's a long read, but it's a very good read. And there's a summary document that I'd urge you to read, but it talks about how we can integrate this into all of our lives. And the first way in which we do that is by connecting with nature, which I think is just lovely, where we actually think about how we actually are all part of nature. We're not apart from nature, like the Oxford English Dictionary believes that we are. And the Eden Project, incidentally, are campaigning against the OED to get that definition changed. But have a read. There's loads that you can learn about there. But connect with nature, understand how it can have a real benefit on your mental health, on your patient's mental health, on all of us, our families, and it helps you to think very differently about the life choices you make as well. That's from a personal perspective as well. So the Lancet, I've done huge amounts on this, and we're doing this kind of years and years ago, probably a decade ago, but there's some really, the 2021 report is definitely worth a read. Share that with people that listen. And that's talking about how we can change the trajectory as healthcare professionals. So lots of reading and further reading too. I wish I could talk to you all afternoon, but I haven't got loads of time with you. But educate yourselves. So what's next? So I was going to share a bit, be amiss of me not to share where I am working now. So the Centre for Sustainable Healthcare, if you aren't aware, I have been blown away 3 weeks in, and I've been blown away about the number of free resources that are available for healthcare professionals. They've been running since 2008, and it feels like they're really on a trajectory. They've grown enormously over the last couple of years, year or so. And it's a much larger team, and they're doing some incredible things. You may have heard of the NHS Forests. They're the organisation behind that, which I'm sure many of you at your sites have been involved in. But they really want to, the vision is to help people in our health system to shape and deliver sustainable healthcare. So that's all of us, isn't it? There's loads of networks. I'm going to share them with you, resources, courses you can go on, which are really, really like, they really just cover costs, they're minimal costs as well. So I'd urge you to come along or send your teams as well. But the benefit is really just to make sure that we all benefit and can support the planet. So I guess my big, if you can put on your to-do list, I don't know about you, but I put little squares still. I'm still an ICU nurse at heart. And to my tick list is, please can you join our nursing network? There's over 30 networks on the Centre for Sustainable Health. There's a link there taking you to the nursing one. Please log in and join us. There is so much resource on there, new articles, frameworks, things you can embed into practice. But among those 30 networks are specialties. So there's primary care, there's intensive care, there's emergency nursing. There's pretty much nearly every specialty that you can join to inform yourselves as well. Get your teams to join, get your chief nurses to join, your matrons, everybody in your team. Really, let's expand and make sure that we're sharing best practice. So it's a really great hub. And there's also a resource library and an absolute plethora of case studies you can take back and implement into practice. So people have done the hard work for you on the carbon footprinting, on the sustainable quality improvement methodologies. So you can literally lift it up and put it into your places of work as well. So lots of brilliant, brilliant resources. I don't think they're very good at shouting from the rooftops what they do. That's the only thing I'll say about CSH. So you need to get a bit better at that. Next, you might have done these already, is the e-learning for healthcare modules. So you get your teams to do that, share that with your teams, building a net zero NHS. They're all free. They're free for all of you to access. So get involved and make sure you log in and renew your thank you, Neve. I'll respond to the chat in a minute. But have a look and make sure you share the resources. It really is our responsibility to educate ourselves on what's happening and then get the right toolkits to implement practice as well. And next, I'm going to ask you as well, this is my next plea for your to-do list, your tick box, is we need you. So the wonderful Rodney and Emma, and I think Imogen as well, I've been working with my colleague Siobhan to really get your opinions and advice on what do we need. We need you to complete yourself. Only 5 minutes. I've done it myself and I promise it's 5 minutes. I'm not going to make you do it for 20. Is to go through and talk about how you feel about sustainability, what you're aware is happening as well, and what you can do to make a difference, and what great practice and evidence you've seen across your region. So let's put Southeast on the map and get a load of you to finish it and share it with your teams as well. It'd be really, really good to get as many responses as possible, because then Rodney and the team can tailor their resources to make sure that people are getting the right education that they need. So I'm sure Rodney will say a few words about that in a moment. So I'll hand across to Rodney. The next thing that they do, and I've only myself learned about this week, is the Green Team competition, which I think is just brilliant. So there's about a trust coming forward. So Kay, Andrew, this might be of interest to you across your regions. A trust come forward. They have 6 teams with 6 ideas, and basically the competition, an immersive kind of few months in building the case and implementing green practices across the trust. And well, saving environmental impact, which is obviously what I care strongly about, but also if you want to get that hook to get everybody on board, the financial impacts and also the social benefits as well, that triple bottom line. So you'll learn about all those wonderful things that are about sustainable healthcare. So another QR code there for you. I did this last week and I did get a little bit enthusiastic, admittedly, but like it's kind of carbon footprint. It was fascinating. So I did this course for hopefully be a facilitator soon on carbon footprinting. So how you can look at a life cycle assessment or a clinical pathway and then break it down and look at carbon footprinting. So then you've got that evidence to look at, to back up and that support or financial investment you need to make sure. And it looks at carbon hotspots and gives you a baseline and benchmark to then show those improvements that you're making to practice. So which is really, really important. There's also brilliant courses, as I've said, at the Royal College, at FNF. The Queen's Nursing Institute are doing phenomenal things too. Crystal and the team, I think, have had webinars this week. So keep yourself informed. And I will do my best to share them all on the Nursing Network and Siobhan as well. So keep yourselves up to date. So I guess I'm going to leave you with a parting message. Firstly, from the Lancet as well, is from Richard Horton, who's done huge amounts in sustainability. So have a read of that report I spoke about earlier. But nurses and midwives and all health professionals have a responsibility. We have a duty of care, an absolute obligation to engage in all kinds of non-violent social protests to address the climate emergency. We really, really do. We need to work together to make sure that we can combat this emergency that is happening now. And I do love a few quotes, those that know me, so apologies, but not apologies. Alone we can do so little, but together we can do so much. So let's work together. And last but not least, and I love Jane Goodall, a bit of a fangirl as well, is it's up to us to save the world for tomorrow. It's up to you and me. We can't just expect somebody else to do it. We have to all work together for a brighter future for us all. So thank you. So Lucy asked me, the other Lucy, lots of Lucys, is just to leave you with 3 kind of parting key messages really. Is, I guess, a massive plea. Please can you raise awareness across your team, share this presentation, take it back. You can have all of it, all the resources are for you to take forward and share. Click the links, educate yourselves, but take it to your CNO, maybe and pitch to your board. Let's get everybody on side, because everyone needs to be aware of what's going on in the world and make sure that we're all working together. Secondly, big point is that we touch patients. We're the most trusted profession in the world. We touch patients from cradle to grave. We can have massive influence. So start educating patients around you, talking to them about the environment, raising their awareness, signposting to important information so they can know as well and educate themselves and see that lovely ripple effect that someone's just popped in the chat. And then just one final part. There are 28 million of us in the world. We as nurses working collaboratively can, it's not we can change the trajectory of this planet. we can have huge influence. So let's do it. Let's do it together. So thank you. That's everything from me. And I'm open to any questions or comments. And I'm sure Rodney will want to add a few bits about the amazing work they're doing in the central team as well. So over to you.
Thank you so much, Lucy. I don't know where to start. I mean, wowee, what a presentation. I mean, honestly, very inspirational. I mean, you're brilliant anyway, but I have to say a very inspirational presentation. You know, that you've taken us on a journey through that, I think, and it was a stark reality of the challenge that we're facing up front, and clearly the impact that's having, but then actually the second half bringing us up, which you did do, in actually really illustrating the part we can play here, and we can all do something around this, can't we, to really make a difference, and there's huge opportunity. Hope, the word hope, there is hope, and it all starts with us, and we've got a huge part to play in this. I mean, I've made loads of notes, honestly, but really thought-provoking, and I think you definitely have made that plea. There is a call to action here, and I think everybody will be, I know I have been inspired to do something, and leaving this. I mean, what a way to finish it, guys, isn't it? What a brilliant way to finish the week, because there's stuff that we can do following this. And I love the fact we have recorded all of our sessions, Lucy, so that's great. You've got those links about the networks that we can join and how we can actually meaningfully get involved as well. So amazing. Just amazing, incredible. I mean, got loads of stuff in the chat as well. You're gonna have to look at it, obviously, when you can. Really, and Rodney has been inputting actually into the chat as well throughout the presentation. But I'll open it if anybody's got any thoughts, reflections, or anything for Lucy around that. Amazing. Kay, come on in.
Yeah. And this is the right one. I've clapped and hearted and everything, but this was a genuine put my hand up. I got it right this time.
That's right.
I think for me, as a nurse and a midwife, and obviously my focus is very much on new moms, new babies, and getting them on their way. It makes me emotional, because I think we talk so much about trying to have better outcomes for moms and babies, trying to get that baby off to the best start. But unless we get our fingers out, there's not going to be any blinking planet left for them to actually thrive in. So, and poor old Charlotte, I've mentioned Charlotte every time I've been on the screen this week, but I've just WhatsApped Charlotte to say, when the dust settles, I think we maybe need a work stream on this in our MacNeo programme. But I do, because I think actually what better time than to capture people about the import of this? Why is this big? Because you guys are having your babies. They're going to have their families. We need to make sure we've got an environment and a planet that can actually sustain them. So you've fired me up. My hat's killing me, but you fired me up.
I had a similar thought as well, Kay, as being a mum. And it was when I was at the Eden Project with them. I know Rodney's been there as well, and Emma and Lucy as well. But there's a lovely chap there who really inspired me too. And he said, I want to look in my children's eyes, and when the world wakes up that this is an absolute travesty, and these children turn around and say, Mum, what did you do to help? I can honestly say I'm tried my best as soon as I realised the enormity of this problem, what we can do. And I think being a children's nurse as well, it's so evident, isn't it? I think Lucy and I were talking the other day and said, the 50% of the population is children, but they're 100% of our future, and we owe it to them, don't we? It's an absolute duty to make change. Yeah.
Absolutely.
Anyway, sorry, that's my mum's speech there. Over to you, Rodney. Sorry.
Yeah, Rodney.
Just really briefly, Kay, just to give you and others hope in this space. Our colleagues in the Royal College, it's actually just been put up by Emma. Our colleagues in Midwifery are choosing sustainability as a critical theme internationally and globally. And why is that important? Because we know that the best start in life is fundamental in terms of health choices. But we also know that everybody born since 1980, if climate change does not get abated, will experience the worst consequences upon their health. So that's why this is a core priority for all of us. So if you were born after the 1980s, you will see potentially, if we don't turn things around the next 10 years, you will see the worst consequences of the stuff that Lucy outlined today. That's why we need to act now.
Wow, that's stark, isn't it? Yeah. Thank you. Thank you, Rodney. I love that first quote as well. I'm going to go back. The ability to provide healthcare to meet the needs of the present without compromising the health of future generations. That is a real, isn't it? That's why again, the call to action around all of this is so important. I'll just go back. I don't think we could have finished off on a better. I mean, all the presentations this week have been absolutely amazing and fabulous, and the quality has been outstanding. I have to say, it really, really has. So I just want to say a huge thanks again to all of, just to put it on the record, to all of our speakers, but to finish on this one has just been remarkable. And thank you again, Lucy. I think you have set definitely the call to action, and I think you've definitely put a fire in our bellies, as Kay says, to we've got to do something here. And Rodney, your last point says it all. I think we've got a responsibility, haven't we? A clear responsibility, as healthcare workers, but also as, like you say, as mums as well, if you are parents. And wow, anyway, that leads us on, thank you, very nicely to our awards ceremony. So we wanted to do to do awards because there's some absolutely brilliant people doing some brilliant things out there across the southeast within the NHS, and we wanted to be able to recognise all of that. So we've got a set of different award categories that people have put nominations in and citations in, and we have looked at those and have picked our very I've picked our winners for each of those categories. I think there's one category that's got 2 winners actually aligned to it. But I'm really delighted to say that for those who have won today, they will each receive a £1,500 voucher, which will go towards CPD for the Centre of Sustainable Healthcare, Lucy. Woo! And this is for you to be able to, for those winners, £1,500 to be able to use, as I say, at the Centre for Sustainable Healthcare for your organisations. So you'll be able to tap into all of that and there's lots of great stuff that they do, and for you to be able to take back to your organisation. So you need to shout out about the winners that we're about to announce. Go back, make a big deal about it with your comms team. This is absolutely a big deal, as I say. And anyway, you're all absolutely worthy winners. So without further ado, I've got the great Lucy, who's going to talk us through actually each of the awards. I'm going to then say who the winners are, and then obviously we're going to say a little bit about clearly why the winners were worthy winners as well. So without further ado, should we crack on, Lucy? Thank you.
Yeah, I don't think I can have the great Lucy after Lucy Brown, but thank you very much. Right, the winners will probably guess that they're the winner when I start describing, but our first winner for keeping people healthy has been working on an escalation pathway for hospital avoidance for older people. And when we read this, the work that's been amazing, it's a QI project to explore reduced admissions for people living in residential care. So this has been through great collaboration, research, utilising evidence-based research and improving patient outcomes. So I don't know if we've got a drum roll, we've got an actual sound effect, but I'll let you announce the winner.
Oh, thank you. Thank you so much. So the very worthy winners of this award are Beverly George and also Lynn Burr, and you're from the Hampshire Isle of Wight ICB, who nominated, but from Hampshire Isle of Wight. So are you online?
We are.
Brilliant. Brilliant. Well done. Well done. No,
thank you so much.
Really fantastic. Thank you so much. So there you go, £1,500 to take back.
Wow, thank you so much.
Wow. I know. And we'll be in touch. We'll be in touch, obviously, with more details around that. So so don't worry. But well done.
Thank you so much.
Thank you,
Beverly and Lynn, did you want to quickly for a couple of minutes explain your project?
Hi, yes, obviously, Lynn and I work together in the South East and as quality facilitators for care homes. And we obviously had a real passion for avoiding admissions and actually supporting homes, because we appreciated that care home staff are very vulnerable. They don't always feel that they've got the support outside of the care home to actually manage patients with complex health needs. And obviously that's where we came in. We provided the education and training through champions groups, and obviously embarked with our partners in the SHPCA to actually help them in providing that professional support. So yes, it's been a partnership thing, but actually it's proven for the quality of life for the residents and for the staff in residential homes.
Brilliant. Well done. Well done.
Thank
Again.
you.
Thank you.
No, amazing, amazing. Okay, right. Well, should we go on to our next category?
Sounds great. So the
Awesome.
next category is right care, right place, and right time. Now, this team have worked with diabetic patients, and they've been looking at the hybrid closed loop insulin pumps and the better control of diabetes, which improves the patient outcomes significantly. This has reduced their need to come in for DKA admissions, their quality of life, and a reduction in their H1AB1Cs. So this has a huge impact on their risk of complications in adulthood. But this work has had a heavy emphasis on education and supporting to safely manage these children, so you're probably guessing who are the winners, and future plans to involve more education. So I'll let you do the winner.
The drum roll, drum roll, drum roll. So the worthy winners are the Frimley Cross site paediatric diabetes team, and in particular, shout out to Caroline Hill. And Caroline, I hope are you online? Is she here?
I think someone's here to accept it on her behalf.
Oh, brilliant. Who's that?
Let me see. Is he still here? Oh, maybe he's gone.
Maybe
it was
gone.
Someone called Blathin.
Oh,
I
okay.
think, but who's not
Oh, well,
here.
not to worry. Well, anyway, amazing, and again, really fabulous, worthy winners. So don't worry, we'll drop them a line. That'll be another nice thing to do after this, actually, to be able to touch base and do it again. So that's nice. Fantastic. Okay, shall we go on to the next category?
Yeah, sounds great. So this one, we just couldn't decide with the winners. It was really difficult, so we had to go for 2 winners. The next category is low carbon treatment and care settings. And the first person was already a presenter earlier in the week, and they were an absolutely incredible presenter. I unfortunately missed it, but I've heard the feedback and it was brilliant. A fantastic project on food waste that's led to strategies to reduce food waste, increasing plant-based vegetarian meals, and developing a recycling scheme. And this has had huge impacts on this trust, with recommendations for enormous carbon savings and how a nurse can change a whole process at a hospital. So the winner.
So the first winner is Susie Moody from University Hospital Southampton. Is that, yeah? Is Susie?
Yeah, that's the one.
Thank you.
Yeah, you're on. Brilliant. Well done. Well
Thank you very much.
No, pleasure. Fantastic. And thank you again for presenting as well earlier on in the week. Absolutely delighted. Very worthy. And so shall I just go straight into our second winner, Lucy?
Well, just Susie wants to give a quick overview if anyone didn't
yeah,
hear.
In fact, yeah, absolutely, Susie. Right, problem.
Gosh, I think the first thing to say is that it wasn't just me. It was collaborative. I was the only nurse involved, but it was quite definitely a group effort with our contractors, Serco, our catering contractors. And I basically just quantified the food waste at ward level and went back to them and said, what can we do? Can we do this? Can we do that? And everything I asked for, they said, yes, we can. Maybe now, maybe like in a month, maybe in a couple of months, but it's become a very, very strong theme within the catering for the whole hospital, is that we want it to be more sustainable and that we'll keep looking for ways to improve it. So well done to all of us, I think, not just me. But thank you very much.
Yeah, brilliant. Yeah, team effort, excellent. And so our second winners for this category are Samantha Wybrow and also Kath Cooksey. And they're from Medway, I think. Are both of you guys on?
Yes, I'm here.
Yes,
Unfortunately,
excellent.
Kath couldn't be here, but I am.
Brilliant, 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 brilliant. So, well, Samantha, again, huge congratulations and well done. And do you want to just give us a quick overview of your project? Thank you.
Yes, so we have focused in on asthma care for our children and young people population. We've done a lot of work with changing the whole entire system. We've put in place a inhaler recycling scheme. We've done a lot of work between changing NDIs to DPIs. We're implementing asthma-friendly schools. We are working with the eco hubs to promote a sustainability shield to get schools involved about planting green screens and walking to school projects and anti-idling projects. And I mean, I could speak forever. I really could, but thank you so much.
No, fantastic. Thank you. And again, as I say, really worthy winner. So there you go. Take your voucher back with pride. Right, so that leads us on now to our final category, doesn't it, Lucy?
Yeah, so the final one in clinical leadership, systems and workforce. And again, this was a clear winner in this category. This also was somebody that presented earlier in the week, and this nurse was able to make a really, really impactful programme. She spotted a need for her staff and she was able to create a programme that's had enormous benefits. And again, we were privileged to hear her present earlier in the week. I'll let you announce the winner.
Oh, thank you. Drum roll again. And the worthy winner of this category is Sadie Sullivan, who is from the University Hospital Sussex. And Sadie, are you with us?
I am, yeah. No, thank you so
brilliant.
much.
Brilliant. Well done. And again, thank you for presenting as well.
Pleasure. I
That's
echo
all right.
My lovely colleague from earlier, though, because this was very much a team effort and I couldn't have done it without everybody else. So I'm very proud of our directorate for supporting such an important project. So thank you very much.
That's all right. Do you want to just give a quick overview of what you achieved?
Yeah, I mean, we work in acute services for paediatrics, and we very much identified that our attendances. Sorry, I'm in a noisy place. We very much identified that our attendances and acuity of mental health patients had gone up quite significantly, and the impact on that was having on staff from a pastoral point of view, but also the lack of education they had previously. So we wanted to put a programme together that covered a foundation education programme, from everything from common conditions through to feds management through to how to best work in an acute setting. And yeah, it was a really well reviewed project, educationally, but also pastorally. We ran it in a natural environment, and that impact on the staff was massive. Lucy will also be pleased to know this is my Florence Nightingale QI project as well. I'm currently a scholar with Florence Nightingale as well. That's part of this. So yeah, it's a big project. We're really proud of it, and we're really grateful to put this into it as well. Thank you, everybody.
Oh, amazing. Well done, everyone. Honestly, as I said, richly deserved, and you can take some good back to your organisations and utilise the vouchers, as I say, for the benefit of more. So, and going back to, as I say, Lucy's final presentation of taking it forward to make a difference. Well, that draws us to an end. I feel a bit sad actually, but it's been an absolutely amazing week. Can I just give a massive shout out to Lucy and Kate, Lucy Plan and Kate Townsend for your honestly for getting us where we needed to get to for this week and for making this week happen. And for all your preparation. Honestly, you've done an outstanding job, the pair of you, I have to say. And you've helped me and Kay, who I'd also like to say a huge thanks to for co-chairing this week with me. But both of you really have helped us and make this possible. So I do feel sad, but actually it's just I wouldn't say a start, because there's lots of great work going on, isn't it? But I think it's given us a spring in our step to take this, go forward and to really make this, go stronger, I suppose, together, isn't it? And go on to make a massive difference around this. So huge thanks. It's been an absolute privilege, I have to say, chairing. I'm sure Kay would say the same as well. It's an absolute privilege chairing this week, and to listen to all of the fantastic presentations and the great work that's happening. So thank you. Lucy, did you want to come in?
Well, I did, just to say thank you, and what a privilege it's been to be able to work with you all on this, because it is that kind of starting point, but not a starting point because there's incredible work that's happening, but raising and amplifying the voice. I was thinking, because we found it really difficult to plan the timings for how long the awards would take, I was wondering if everybody wanted to write a pledge in the chat box about what they're going to take away, either from this week or from today, and how actively, as nurses and midwives collectively together, we have got so much more power than we realise, and that power of influence by just sharing this incredible learning. So I just thought I would open that up if everybody wanted to put a pledge in.
Yeah, what a great idea. Yeah, let's do that. Thank you, Lucy. And of course,
Kate
everyone
wanted to add anything. Sorry,
yeah,
Andy.
Kate, do you want to add anything? Thank you.
I'm just getting excited as you can. Oh, sorry,
Kay or Kate. You go, Kay.
No, you go.
Yeah, I hear a lot of sustainability presentations, and even now, after 2 years of working in them, you can still really feel quite emotional from hearing about it, and not just like the doom and gloom of the future, but also getting inspired by everyone who's working towards it. And this has just been absolutely one of those weeks where it's been a wonderful hour of inspiration, and I think we should really try and do more stuff like this. And it's been so good to hear about the sustainability stuff that wasn't even on my radar, and just goes to show how many people are passionate about it and how much is going on. So yeah, hats off to everyone, or fascinators off.
And fascinators then. Thank you, Kate. And Kay, sorry, did you want to just come in?
I did. I'm trying to type. I'm hopeless on this. I was just going to say, I'm sure we're having another one next year, but I think one of the things we need is a 6-month touch point where we all come back together to see where are we at with our pledges that we're doing, but also to get some ideas if it might be that people need help or other people would like to get going with it. So I'd like to see that. I think that would be marvellous. And to say just such a marvellous job you've done. But I also want to just shout out to Andrea, because I think your leadership here as well, and the way that you've pulled people together is just marvellous. Well done all.
Thank you, Kay. To get a marvellous from the marvellous Kay is always lovely, isn't it? You're going to have to start getting some badges made, Kay, I'm just saying. But thank you, that is really kind. So I like the idea of that 6-month touch point. Let's do it. We're making a pledge right here, right now. Let's do that, because I think that you're right. We're on a movement now, aren't we? But this has been the first nursing and midwifery Green Week for the NHS. And this is the start of, well, clearly this is it now. So we will be having one again on a yearly basis to celebrate even more so the great work that's happening. So yeah, we're on the start of a journey, but I want to recognise the journey's already started because of the great work that's clearly already happening and what we've heard about this week. So well done, everyone. Brilliant finish to the week, finishing Friday on a high. So thanks again, and I look forward to seeing you all next week and going forth actually, and enjoying seeing some more of this work taking place, and wherever I can help, please do reach out. As you know, I'm really keen to get involved and speak to people. So yeah, thank you, and thanks again to all the winners. Well done. But have a lovely weekend, everyone, and
Thanks,
take care.
everyone.
Thank you.
Thank you.
Thanks all.
Bye.
Bye.